Imagine, just for a second, a threat to horses that's kind of hidden, silent. But it has this huge potential power to basically change everything about global horse trade, about animal health policy. Today, that's exactly what we're diving into, equine piroplasmosis. EP, for short. We've gone through, well, a whole stack of information, cutting-edge vet research, practical guides on prevention, and we've pulled out the really crucial stuff for you, all distilled down.
Yeah, our goal here, our mission for this deep dive is pretty clear. We want to really get a handle on what EP actually is. How does this pretty clever disease spread so quietly? What's the real-world impact on the horse? And maybe most importantly, why is this something that really needs our attention globally? Especially when you factor in the huge economic and trade side of things for, well, the entire horse world.
Exactly. We're going to try and break down the complicated science bit, make it understandable. So you come away with a solid, quick grasp of what is actually a very significant, often underestimated equine disease. Okay, let's unpack this. So at its most basic level, equine piroplasmosis is what's called a tick-borne protozoal disease. Now, protozoal, that just means it's caused by a tiny single-celled organism. It's not a bacterium, not a virus, something different. And crucially, it doesn't spread horse to horse like, say, the flu, but don't let that fool you. Its transmission is incredibly sneaky, often invisible until it's already happened.
That's a really key point. The specific culprits causing all this trouble are two main microscopic parasites, Theileria equi and Babesia cabali. And, for anyone who's been around this topic a while, you might remember Theileria equi used to be called Babesia equi. They reclassified it. Understanding the difference between these two is, well, it's fundamental, as we'll see later on.
And it's not just horses, right? That's important. This hits a wider group of equids. We're talking mules, donkeys, even zebras. So when we discuss EP, it really affects the whole equine family.
Exactly. And geographically, EP is endemic, meaning it's commonly found in lots of tropical and subtropical areas. Think parts of South America, Central America, Africa, bits of Europe, the Middle East. It's just sort of there. But then you look at places like the US or Canada, there it's classified as a foreign animal disease. And that difference, it's huge. It means any sniff of an outbreak leads to really intensive monitoring, containment efforts. It directly impacts rules around importing and exporting horses.
Okay, so how does it actually hurt the animal? The main thing, the core impact, is that it attacks the horse's red blood cells. It literally makes them burst. That process is called hemolysis. And this destruction, this loss of red blood cells, leads straight to anemia. That's where most of the clinical signs, the things you actually see, come from. It's a direct hit on their oxygen-carrying ability.
So how does this tiny invader, these protozoa, actually manage all this? How do they get in, survive, and spread? Well, the life cycle of Theileria equi and Babesia cabali is pretty complex and worrying. Ticks are the absolute key here. They're the bridge. Certain types, certain like dermacenter, rhipicephalus, hiloma, those are the main vectors. They're what we call the definitive hosts. The parasites, when they're in their sporozoite stage, they develop inside the tick's salivary glands. Then, when the tick bites a horse to feed, bam, they get injected right into the bloodstream. Once they're in the horse, these sporozoites find and invade red blood cells. Inside the cell, they change into something called merozoites. And these merozoites, they just multiply and multiply inside the red blood cell until it bursts open lysis. That releases a whole new batch of merozoites, which immediately go off and infect more red blood cells. This constant cycle, invade, multiply, rupture, repeat, that's what drives the disease and causes the signs we see.
Okay, now here's where it gets really fascinating, I think. The differences between the two parasites, Theileria and Babesia. They cause the same named disease, but they're not identical. Take Theileria equi. It has this unique stage before it hits the red blood cells. It actually infects lymphocytes first. Those are a type of white blood cell. This extra step seems to make T. equi generally more pathogenic, more aggressive. Infections are often more severe. They last longer. And crucially, horses that get T. equi often become lifelong carriers, even if they look perfectly healthy. And although it's rare, T. equi can sometimes even pass from a mare to her foal in the womb, occasionally causing abortions. Now, compare that to Babesia cabali. This one mostly just insects the red blood cells directly, no messing with lymphocytes first. So infections with B. cabali often tend to be milder, and here's the big difference. Horses might actually clear the parasite completely over a few years, though it's worth noting, during the acute phase, B. cabali can sometimes cause problems by blocking tiny blood vessels, capillaries in places like the lungs, liver, or brain. But that intragrotorine transmission, very rare for Babesia. So you can see which parasite the horse gets really changes the long-term picture for its health and its future.
Absolutely. And this whole process, even after the horse seems to recover, leads us to a really critical concept. the carrier state. This is so important. Horses that survive that initial acute phase often become chronic carriers. They might look fine, completely healthy, no obvious signs, but they still have low levels of the parasite circulating in their blood. This makes them silent reservoirs. They can infect ticks, which then go on to spread the disease to other horses. And here's the kicker. Things like stress, or if their immune system gets suppressed for some reason, it can actually trigger a relapse. The clinical disease can flare up again in these seemingly healthy carriers.
Okay, so if you're listening, maybe you own horses or you're a trainer or just love them, what does this mean for you practically? You're probably thinking, right, ticks. Focus on tick control. And yes, absolutely, that's vital. But there's another way this spreads, a really significant way, and it's frankly often down to us, humans. It's called iatrogenic transmission. Basically, human-caused spread. Think about it. You use a needle on one horse, then maybe, without really thinking, you use that same needle on another. Or maybe it's a dental float, or some surgical gear that wasn't perfectly sterilized. It only takes a microscopic trace of blood. That's how it happens. Contaminated needles, syringes, surgical tools, dental instruments, even tattooing equipment, or using contaminated blood or plasma for transfusions. It's kind of a massive aha moment when you realize just how easily simple barn practices could potentially spread this disease. It's preventable spread.
Definitely. Now, when we talk about spotting the signs, about diagnosis, one of the biggest challenges with EP is that the signs are often incredibly nonspecific. They can look like so many other things. It's really quite deceptive. In very rare cases, you might see the paracute form. That's usually sudden collapse, rapid death. Almost no warning, very scary, but thankfully rare. Much more common is the acute form. Here, you're looking for signs like a high fever, spiking maybe over 104 Fahrenheit, 40 Celsius. The horse will seem off, listless, loss of appetite. You might see jaundice or icterus, that yellow tinge to the gums, eyelids, mucous membranes. Anemia is a big one. Pale membranes, maybe a faster heart rate or breathing rate as the body tries to compensate. And a really characteristic sign, particularly with T. equi, is pigmenturia. That means the urine turns red or dark brown. Some people say it looks like cola. That's a serious sign of massive red blood cell breakdown. You might also see tiny pinpoint bruises, petechia, or larger blotches, ecchymoses on the membranes. Swelling or edema can occur often in the legs, chest, or face, and sometimes mild colic signs too. Then you've got the subacute form. It's like a milder version of the acute signs. Maybe the fever comes and goes, some weight loss, the horse just isn't performing well. And finally, there's the chronic form, or that carrier state we talked about. Here, signs can be really subtle or even completely absent. Maybe just mild anemia if you did blood work. Maybe they're just a bit off their game, slight weight loss. But often, these horses look perfectly healthy. They're carriers.
Okay, so given how tricky these signs can be, how do vets actually confirm it? Especially since, as you said, it's a reportable disease in many areas. Lab tests are obviously key. One thing they might do, especially if the horse is acutely sick, is a blood smear examination. They take a drop of blood, stain it with gemstain, and look under a microscope. You can actually see the parasites inside the red blood cells, and you can even tell them apart sometimes. Babesia cabali often looks pear-shaped, maybe in pairs. Theileria cause is usually smaller, more varied shapes, sometimes forming that classic four-parasite cluster people call a Maltese cross, OGT3. And this is but this method isn't very sensitive for chronic cases or carriers. The parasite numbers are just too low. And critically, it's not accepted as proof for international horse movement. That's where serological tests become really important. These are the main tools for finding those carrier animals, the subclinical cases, and for testing horses before they travel internationally. They don't look for the parasite directly, but for the horse's immune response to the antibodies. It shows the horse has been exposed, even if it's not sick right now. Tests like the indirect fluorescent antibody test, IFAT, and the competitive ELISA, or C-ELISA, are very specific, very sensitive. And actually, the USDA uses the ELISA as its official test for EP in the States. And then there are the really advanced techniques, the molecular tests like PCR. PCR stands for polymerase chain reaction. Think of it like a highly sensitive DNA photocopier. It can find even minuscule amounts of the parasite's genetic material in a blood sample. Super specific, super sensitive. It's incredibly valuable for picking up carrier animals with those really low parasite levels that smears might miss. There's even quantitative PCR, qPCR, which can give an idea of how much parasite DNA is that the parasite load. So PCR is used more and more, often alongside serology, for accurate diagnosis and also to confirm if treatment has actually worked if the horse is clear. Other things vets might see on general lab work. A complete blood count, a CBC, might show anemia, low platelets. Serum biochemistry could show high bilirubin levels, pointing towards liver involvement, or that red blood cell breakdown.
And sadly, for horses that don't make it through an acute infection, a post-mortem exam, a necropsy, can show some pretty clear signs. Vets might see widespread jaundice, yellow tissues everywhere. Organs like the spleen and liver might be enlarged, and there could be hemorrhages, bleeding spots, especially on those mucous membranes. Right, so when we talk about fighting back, about treatment for EP, the aims are pretty clear. We want to kill the parasites, get rid of the clinical signs, and ideally, completely clear the infection so the horse doesn't become a carrier and can't spread it further. But we have to be realistic here. Getting that complete clearance, especially for Theileria ochitzia, can be really, really challenging.
The main drug everyone uses is called imidocarb dipropionate. And the way it's used is very specific. It actually depends on which parasite we're dealing with. For Babesia cabali, it's typically 2 injections spaced apart. But for Theileria equine, because it's tougher to get rid of Implypia, it's a more aggressive approach. Usually 4 injections, higher dose, give it over several days. Now, imidocarb is potent stuff. It can definitely cause side effects. Things related to the nervous system, colic, diarrhea, maybe excessive drooling or sweating, muscle tremors. So vets watch for these very closely. They might even give another drug at the same time, like atropine, to counteract or manage these side effects. And in the U.S., if a horse tests positive and goes into treatment, it's under a very strict official USDA ACS program. The horse is quarantined, treated with imidocarb according to the protocol, and then has to test negative repeatedly before it can be released from that program. Oh, and a really critical warning. Donkeys are extremely sensitive to this drug, very susceptible to toxicity, so they should absolutely not be treated with imidocarb.
Definitely not. And alongside the specific drug treatment, good supportive care is just crucial, absolutely vital. This could mean things like IV fluids, especially if the horse is dehydrated, or if there's concern about kidney function due to all that hemoglobin being released from broken red cells. For horses with severe anemia, a blood transfusion can literally be a lifesaver. Of course, the donor horse has to be compatible and guaranteed EP negative. We also use things like NSAIDs, nonsteroidal anti-inflammatories like Flunix and Miglumin to help bring down fever and reduce inflammation. Sometimes gastroprotectants are needed to protect the stomach. And basic good nursing care nutritional support, keeping the horse quiet and rested, that's all essential for recovery.
So treatment is complex, often difficult, which really underscores why prevention is so important. Especially since right now, there's no commercial vaccine available for EP. One big part of prevention, as we touched on, is solid tick control. That means using appropriate tick treatments, regularly acaricides or insecticides, managing the pasture environment, like keeping grass short to reduce tick habitat, and just being vigilant. Daily, thorough checks of your horse for ticks and removing any you find straight away, carefully. But, and this is maybe the biggest takeaway for everyone listening, the most critical thing is implementing really strict biosecurity practices. Why? To stop that human-caused, that iatrogenic spread we talked about earlier. This means, and it sounds simple, but it's crucial always, use a brand new sterile needle and syringe for every single injection, on every single horse. No exceptions. Never reuse. It also means you have to be meticulous about cleaning and disinfecting any equipment that could possibly get blood on it between horses. Think dental tools, surgical kits, even tattooing needles. Ideally, use heat sterilization, like an autoclave, if possible. And if you ever need to use blood products, like plasma, only use products that are commercially licensed and have been tested and confirmed negative for EP. These practices, honestly, they can make a massive difference in stopping this disease in its tracks.
Absolutely. And another layer of prevention is surveillance and reporting. In countries where EP isn't normally found, it's a reportable disease. That means if a vet even suspects a case, they have to notify animal health authorities immediately. Any infected horses, or even those exposed, are put under strict quarantine to stop any potential spread. And, historically, in some non-endemic countries, if a horse tested positive, the options were pretty grim, often euthanasia or mandatory export. But now, certainly in the U.S., the USDA APS does have these approved treatment programs under specific controlled conditions, which is a really significant step forward. Okay, so looking ahead, what's the prognosis? What are the long-term prospects for a horse diagnosed with EP? Well, it really depends on a few key things. Firstly, which parasite is it? For Babesia cabali, the outlook is generally quite good. With treatment, horses usually recover well and, as we said, might eventually clear the parasite completely. But for Theileria APO, the prognosis is definitely more guarded. The infections themselves tend to be more severe, and it's much harder to fully eliminate the parasite. Many horses, even after successful treatment of the clinical signs, remain lifelong carriers.
And I guess how sick the horse got initially and how quickly they started treatment, that makes a difference too, right?
Huge difference. Early diagnosis, getting that treatment started aggressively, that significantly improves the odds of a good outcome.
And even if the horse looks fine after treatment, that carrier status, especially with TIECI, has major long-term implications, doesn't it? You mentioned the risk of relapse if the horse gets stressed, but there are also big restrictions on international travel for carrier horses, and just the ongoing need for careful biosecurity management around them. It doesn't just go away.
Exactly. You really can't overstate the impact. Equine piroplasmosis has massive economic and trade consequences around the world. It directly affects how horses move, where they can go, their value. So effective control really boils down to those key pillars: vigilant, strict biosecurity, relentless tick management, and accurate, reliable diagnostic testing, especially for any horse that's going to move internationally.
Wow, what a journey we've just been on, from thinking about these absolutely tiny protozoa hiding inside red blood cells, all the way up to the massive global scale, impacting horse health, international trade, economics. It really is quite something, a powerful reminder of how seemingly small things, like, as you said, just reusing a needle, can have these enormous cascading effects across an entire industry worldwide.
It absolutely does. It really underscores the incredible complexity, the interconnectedness of it all. Disease, the health of our animals, our own human practices, things like global trade, it's all linked. Understanding these intricate biological systems, I think, is just so vital for anyone involved with horses in any capacity.
So as we wrap up this deep dive, maybe something to think about is, what could be the next hidden threat, the next thing like EP waiting in the wings, and how does understanding these complex systems, like the one we've just unpacked, better prepare us for whatever that might be? What new connections might you see now, knowing how something as seemingly simple, as basic as a shared needle, can actually send ripples across the entire globe?